Good afternoon, everyone, and welcome to this amazing opportunity to have conversation focused on women's health. My name is Dr. Yolanda Hancock, and I have the distinct honor of serving on the board of directors of the American Heart Association Greater Washington Region. Thank you so much for joining us today for this community conversation, Breaking the Silence, How Women Can Advocate for Their Heart Health, in honor of American Heart Health Month, a time that focuses on women's heart health in particular. And as obviously a woman with a strong family history of heart disease with my mom and my grandmother, this conversation really speaks close to home. I'm also a mommy. I have a daughter, and being able to learn, even though I'm a physician, I'm super excited to have this conversation with Dr. Zhang. This program is being brought to all of us in collaboration with one of the American Heart Association's allies in combating heart disease, Suburban Hospital, Johns Hopkins Medicine in Bethesda, Maryland. Suburban Hospital and its generous donors have been dedicated to educating and supporting women for decades. And I can speak to that because I have been invited to participate in this conversation on several occasions. In fact, we're going to give it up to Suburban Hospital and Johns Hopkins Medicine in Bethesda because today is the 24th annual Women's Health Symposium dedicated specifically to this topic. So hit that reaction button. We're going to give these snaps and these claps to say thank you for their commitment to women's health. Before we begin, I want to thank today's proud local sponsors. First is the American Heart Association's Go Red for Women. Both Dr. Zhang and I have gone red for women. Uh, Designed to increase women's heart health awareness and serve as a catalyst for change to improve the lives of women globally. We would also like to thank the J.B. and Maurice C. Shapiro Endowment for Women's Health, who has supported the Women's Health Symposium for over 20 years. As a double board certified pediatrician and obesity medicine specialist with my personal history of heart disease within my family, I always love to show up in these spaces to be able to not only have a conversation, but learn so that I can protect myself, learn how to advocate for myself, and also advocate for my daughter and generations to follow. Advocating for our health as women, it's essential to our wellness, especially as hormonal transitions during perimenopause and menopause significantly impact our long-term cardiovascular and metabolic health. And I can speak to that being 50 plus now. However, the constant and sometimes conflicting health information on social media, in mainstream media, can often leave many of us, including myself, confused, overwhelmed, and oftentimes unheard. Today, we will discuss with Dr. Tina Zhang, who is the co-director of Women's Wellness and the Healthy Aging Program. She's also the director of the Johns Hopkins Academic Women's Health Fellowship in General Internal Medicine. They didn't play when they got a heavy hitter to have this conversation with us. We will discuss relative healthy aging topics such as hormone replacement therapy. We're going to talk about something called lipoprotein A, LPA protein scores, and what our blood pressure goals should be. A lot of information to cover in a short amount of time. Before we begin, I want to mention just a few housekeeping items to make sure that you get the best of your experience in this hour. We'll do our best to answer every question that you pose to us throughout the program. If you have a question, please use the question and answer box located at the bottom of your screen. There is no silly question. The only silly question is the one that you don't ask, all right? Today's presentation is being recorded, so we can share as we care. It will be available in the coming days for you to view again and to share with your family and friends. Men, women, everybody, because everyone needs to hear this information. Your feedback is very important to us and helps us to continuously improve these offerings so that in the 25th year, it's reflective of what you want and need. At the end of the program, a link to a brief evaluation will appear on your screen. Please take a moment to complete the evaluation as it helps us plan future programming for our community so it reflects your priorities. Thank you so much. So now, without further ado, I would like to introduce Dr. Tina Zhang. Dr. Zhang, welcome to the conversation. Please tell us about your focus. Tell us about your background and all of the amazing work that you're doing.
Thank you so much, Dr. Hancock, for the wonderful introduction. I am so honored to be here today with all of you. I also have a strong passion for women's heart health. I come from a family who also have a pretty significant family history of heart disease and my father, and I have two little girls as well. So I am so honored to be here. At my core, I'm a very proud general internal medicine doctor and a primary care doctor, but I also have additional training and expertise in women's health, specifically in menopause and perimenopause and healthy aging. So I'm a Menopause Society certified practitioner. I also have a specific interest in cancer pre-survivorship as well as cancer survivorship. So I spend a lot of my time caring for women with different cancer diagnoses who are going through the menopausal transition as well. And then finally, I identify as a clinician educator. I did a fellowship in medical education, so I spend a lot of time working with our Hopkins medical students, our residents, and our faculty during education and really trying to improve women's health education across the training continuum.
Wow,
So
like
honored to be here. Thank
it's
you.
incredible. You touch in every area from training the next generation of providers, of physicians, being of support and education for your colleagues, and then continuing that all the way through in terms of patient care. I'm so in awe of you. I'm I'm in awe. Let's
The
jump into this
admiration
conversation.
goes ditto to you, Dr. Hancock. So honored
Listen,
you're facilitating today.
listen, you guys are going to feel a lot of love in this hour. In the news, Dr. Zhang, there has been a lot of discussion about hormone replacement therapy and its
Mm.
impact on women's heart health. And I can speak to this specifically in terms of my own experience as a patient. So I went through what we would consider early menopause. Didn't have a period after having my daughter. I had my daughter right before I turned 40. I thought I wasn't having a period because I was breastfeeding for 2.5 years, and then finally went in to see the doctor, even though my intuition told me that that's sort of where I was moving towards. And in a very cold, sterile way, on a phone call with the nurse, just reviewing my lab results, I learned that I was in menopause at the age of 41. And it was devastating, and I didn't know what to do. The conversation started and ended there with just some lab results. And so I went to all those sources I knew to go to figure out what am I supposed to do next, especially given my family history of having a great grandmother who died of a massive heart attack the year I was born, my grandmother who had previously survived 4 heart attacks, and my mother who had survived a stroke. I didn't know
Wow.
what to do and no one to really guide me. So can you please tell us about menopause? How do we manage it, especially with this HRT that we keep hearing about? How does all of this affect our heart health? And what are our risks?
Absolutely. First of all, thank you so much for sharing that, Dr. Hancock. I think it's a perfect example of how women just sometimes feel like they don't know who to go to, where to get the right information. I think that's why I'm so honored to be here today to talk to you all about this. Menopause and menopausal hormone therapy has really been a very hot topic recently, pun totally intended here. But I think, there's a lot of information that's being thrown out, and it's hard to decipher, what's evidence-based, what's applicable for each individual patient. And I think really to understand menopause hormone therapy, you first kind of need to understand what menopause is, what perimenopause is, what our symptoms are. So maybe I'll start there, and then we'll talk about menopause hormone therapy after that. So the thing about menopause, it's getting so much attention right now, but it really is a natural process of aging for all women who have ovaries and female reproductive organs. So our moms went through it, our older sisters, our grandmothers, etc. But we specifically refer to menopause as just the loss of ovarian function over time. Our follicles, our eggs are no longer producing estrogen. So what's happening is our estrogen is decreasing in the body, and we no longer have menstrual cycles. So we define menopause clinically as 12 consecutive months without a menstrual cycle. Once you go 12 months without a menstrual cycle, you're formally in menopause. But the symptoms of menopause start often way before that. And so the period of where those menopause symptoms start, when you start noticing some changes in your menstrual cycles, we call that the menopause transition or perimenopause. And then once you hit that 12-month mark, you're basically postmenopausal. So the common symptoms you're going to hear about are things like hot flashes, night sweats. I think these are things you see on, TV series and are kind of common. But a lot of patients don't realize some other symptoms are very common for perimenopause. In particular, brain fog, feeling like you're having a hard time finding words when you're trying to give a talk to 100 people, like mood changes. Why are you so, all of a sudden super angry at your partner? And where did that come from, right? Low libido, we see a lot. Sleep issues is very common. It's probably one of the primary complaints I hear from patients. Hair and skin changes, joint pain, and obviously changes in the menstrual cycle. They start spacing out, they become really irregular, they become heavy out of nowhere. All of those are the symptoms. And so for some women, the symptoms are not significant. They're not significantly impacting their everyday life, and they can manage it by wearing layers, having a handheld fan, etc., etc. But for a lot of women, it actually really impacts their quality of life. And we actually have data that looked at, how often women are missing work because of their menopausal symptoms. And they found, this was a study from the Mayo Clinic, they found that, like, based on the work days missed because of menopause, there was an annual loss of $1.8 billion in the United States just related to, not being able to tolerate the menopausal symptoms and leading it to missing work. So right now, our most effective treatment is menopause hormone therapy. It's basically giving the body back the hormone that has been missing and declining over time, and specifically the estrogen. So the primary reason and the primary indication for menopause hormone therapy is to help treat and alleviate the menopausal symptoms that women are experiencing. We know for a fact it's going to help with hot flashes, night sweats, vaginal dryness, brain fog, sleep, etc. So that's really menopause hormone therapy more broadly. And then I think I can dive in particular to what the hormones are and the risks and benefits of them. So when we talk about menopause hormone therapy, we're referring specifically to two hormones. The first one is estrogen, and the second one is progesterone. And I like to use an analogy, Dr. Hancock, of an ice cream cone. Number one, because I think it's a little bit easier for patients to understand. And number two, because I just love ice cream so much. So I like to really incorporate it whenever I can.
I
Um,
love it.
but yeah, so, I think when I'm craving an ice cream cone, I'm craving the ice cream. So when we talk about menopause hormone therapy, it's estrogen is the ice cream. This is the MVP. This is what's really going to help with the symptoms. But what we know about estrogen is that if you give it unopposed in patients with a uterus, it makes the lining of the uterus thicker and it increases the risk of uterine or endometrial cancer. And so we have to hold it in place, kind of like you hold ice cream in place with a cone. The
Right.
progesterone serves as the cone to hold the ice cream and the estrogen in place so that it doesn't spill over. And so in patients with a uterus, they have to have both estrogen and progesterone. And the progesterone, the real impact of it is really just to protect against uterine cancer. Um, and then in patients who don't have a uterus, they technically don't necessarily need progesterone. They really just need the estrogen. And then in patients who are using just vaginal estrogen for, vaginal symptoms, it's such a low dose that they don't need progesterone either. So, in terms of like who benefits from menopause hormone therapy, it really is women who are having significant menopausal symptoms. And we also know, just based on our research and our data, that women who are less than 60 and within 10 years of menopause onset, the benefits of hormone therapy really outweigh risks associated with hormones, especially in patients who don't have a reason not to take it.
Excellent. And there's been some concern or some uh, conversation around HRT specifically related to heart health. Can you speak to that as well?
Absolutely. So I think estrogen is a little bit confusing when it comes to the heart because it has a dual effect on the heart. We call it the duality of estrogen. And basically, in younger patients who do not have heart disease, estrogen is very protective of the heart. It will help to prevent long-term issues. It will help to prevent heart disease. And the reason it does that is because it promotes the function of the lining of the heart arteries. It opens up the blood vessels to allow the blood to flow better. It helps with maintaining healthy cholesterol levels. So it just has a lot of benefits. And so in patients like in your case, Dr. Hancock, who underwent early menopause, one of the things that we are doing to replace the hormones, not only is it to manage your symptoms, but it's to make sure that we are helping to protect the heart as well. However, on the other side of the coin with estrogen, in patients who have vessels that are less healthy, or if they already have known plaque in the heart arteries, if they have heart disease already, the estrogen makes the plaque less stable,
Mm,
increases the risk of plaque rupturing, and can lead to the plaque becoming and growing. And so that is why we do not recommend hormones, specifically estrogen, in patients with known heart disease. And if you look at all the data, all the different larger societies, the American College of Cardiology, the Menopause Society, the International Menopause Society, etc., they do not recommend being on estrogen just for heart health alone for prevention. They
mhm.
recommend it more to manage menopause symptoms, knowing that there is an additional benefit of protecting the heart in younger patients.
Listen, you just left me with all the pearls. I think for a lot of us who are trying to make that decision, because you hear a lot in social media about like the dangers of HRT.
Yes.
And sometimes even within the medical community itself, it can be confusing because your internal medicine doc will tell you one thing, your OBGYN will tell you something else, and it's hard to quiet all of the information enough to be able to pull out what you need. And you just did an amazing job. The 2 minutes you broke that down has helped me to understand how HRT has served a role in my own life. So thank you. I've already left with a pearl, and we still have a good 40 plus minutes in conversation. So thank you. I
I
feel like
love
I've
it.
got my money's worth already. Thank you so
I'm
much.
so glad. That's the thing, there's so much information out there. And then there was very recently, the FDA took away the black box warning
Mhm,
for estrogen, which I think is so exciting. I
mhm.
think there's a long history that I won't go into detail about when it comes to menopause hormone therapy, just because I could spend a whole hour talking about it. But I
Right.
think the black box warning did lead to a whole generation of women not being able to get menopause hormone therapy when they could. That being said, it should be very individualized. It should be based on patients' risk factors. More women than they know would qualify and benefit from hormone
Mhm.
therapy. But on the other hand, as the providers, we are very thoughtful to make sure that what we put patients on are going to be safe.
Absolutely. And I think what you speak to is also knowing what your history is, your heart health history, what your own personal risk is. And that's really what Go Red for Women, what this conversation is all about. So for each of our attendees, what we're inviting you to do is make sure you understand what your risk factors are to
Hmm.
determine whether or not HRT will serve use for you in terms of managing menopausal symptoms. And I think you provided such a very clear distinction in how that decision can be made. It's amazing. Speaking of lots of information, there's so much heart health advice on social media. One of my patients' parents just today said we are in an age of popular outweighs accurate. And if the
True.
person is
Mhm.
popular enough on social media, even if what they say is the exact opposite of what is right, people will follow it based on who that person is, not necessarily on the expertise behind the information shared. Can you tell us how do we determine what's credible and what's not? Are there any red flags that we should be looking out for on TikTok, Instagram, Facebook, mainstream media, so we know how to receive the message, evaluate it, and either reject it or receive it?
Great question, Dr. Hancock. I will personally say I spend too much time on social media. I just
Too.
I just really enjoy it as a way to like decompress, and I feel like I'm just like subconsciously scrolling through. And so I think social media can be really empowering. Like I find that a lot of women I see in my menopause clinic are coming to me with information they've seen on social media because, people aren't talking about it in their real lives, and they're able to find this information or find, menopause providers who know this, etc. So I think there's a lot of benefits to social media, and hearing kind of information in a easily accessible manner. That being said, you just don't know whether or not what's being told is accurate or not. And so, a couple things I'll look at, again, I told you I'm scrolling social media all the time. So, a couple things I'm looking at are like information, the source, number one. Is
Mhm.
it a credible source? Is it from a larger organization like the American Heart Association or the American College of Cardiology? Is it coming from a medical institution like Johns Hopkins or Cleveland Clinic or Mayo or any of those larger programs? Are the people who are sharing this information, are they citing their source? Where do they get
Mhm.
the information from? I think if you know where the source is, you can go back and check it. And I think what I worry about are blanket statements. Like if you're hearing an influencer say, hormones are a miracle cure for everyone, or hormones are dangerous for everyone, those absolute statements I think will definitely raise some red flags in my mind. Anything that's like a one size fits all advice, I do not recommend because, like I said previously, when it comes to hormone therapy, when it comes to heart health, it's so individualized. It's not a one size fits all. Like in your case, Dr. Hancock, with your family history, with your earlier menopause, etc., I think all of that plays a role in, what we as doctors would recommend for you for healthy aging and prevention. I also worry about influencers who are like selling things, programs or supplements that don't have
Yeah,
any medical credentials. They're not a doctor. They didn't do training. They don't have board certification. All of those things would make me a little bit more concerned. So I think nuanced discussions going through risks and benefits, no one size fits all.
absolutely.
And I think a good rule of thumb is like if you're not sure, like ask your doctor. I think check the work, check the sources, and then verify and confirm.
Absolutely. I completely agree with you. Especially we're in a space now where people are trying to go back to sort of natural ways of healing the body. I often
Yeah.
joke that so my patients call me Dr. Yola because I'm from NOLA, meaning
Oh,
Louisiana.
I
And I
love
also
that.
say I'm also super granola, right? So yeah, like we have essential oils that we use for different things, just in terms of relaxation, et cetera. I practice something called Reiki. I often say that there is space for both. but we have to
Absolutely.
make sure that whatever the recommendation is, that we can use the red yeast rice, but we also have to make sure that there's evidence to support the use of the herb, the tincture, the supplement, in the same way that we make sure that there's evidence base behind HRT therapy, et cetera. And I think that for a lot of audience members, we have folks that are really into the natural ways of healing. And so we can bring that conversation into your provider's office. As a physician, I can say that I wasn't necessarily trained in some of the natural ways of healing the body, but we now have excellent resources that look into it. Hopkins is one. I got my MPH from Hopkins, so shout out to the Bloomberg School of Public Health at Johns Hopkins. There are now spaces where we can actually look up herbs, oils, supplements to see what evidence exists in order to be able to make a recommendation. And as physicians, it's important for us if we don't know to say we don't know, but there are opportunities as a learning moment to research it to figure out how all of those things pair because we may find out that either it does or does not work, or there's an interaction between what you're taking and being prescribed by your physician and what your naturopath or connection may provide to you in terms of helping to heal the body in a more holistic way.
Absolutely. I completely agree with everything you said, Dr. Hancock. And then the thing I'll mention is I'm very supportive of my patients, trying natural options, talking to a naturopath or an integrative or functional medicine provider. A lot of the supplements are not cheap, so it's just making sure that like what they're spending their money on is going to be
Yeah,
actually helpful for what they're trying to fix or treat. But I think it's just important that whatever you're taking, that you let your doctor know as well, because
absolutely.
we may be putting a patient on an antibiotic for a UTI or, a medicine for cholesterol, and it's helpful to know if there may be potentially any interactions. So I think that's the
Exactly.
one thing is like, I think we're very supportive, but just making sure that it's safe too.
Absolutely. Absolutely. Very good. So, speaking of being a patient, as patients,
Yes.
what can we do to make sure that our concerns about our health are met? Because I know as a patient, there have been many a time I have shown up with people knowing I was a doctor and I still did not feel seen or heard. So what can patients do to make sure that their voices are heard and that they are seen? And what can we as physicians do to create space to make sure that we are seeing and listening to our patients?
That is such an important question. And again, I could probably spend an hour talking to you about this, Dr. Hancock, but
Absolutely.
I think, it really is the patient provider relationship is so crucial to patients getting good, appropriate, clinically excellent, evidence-based care. So I think from the patient side, the first thing I'm going to say is just open communication, like being very clear about what your symptoms are, what you're asking about, what you're worried about, so that the doctor knows where you're coming from. We can hear, oh, I'm not sleeping well. And depending on how you frame it, it can be, this is really impacting my ability to function at work, my relationship, it's impacting my weight, it's impacting my ability to drive safely. Or we could hear it as, oh, okay, sounds like you're having a hard time sleeping. I'm sorry, but it sounds like it's not bothering you that much. So I
Yeah.
think just being very specific about what the symptoms are that you're experiencing and how much it's impacting and how much you want to fix and treat it is going to be really helpful. So having that open communication. Sometimes it's helpful to just write down the symptoms and how
Hmm.
often they're occurring, how long they're occurring, because it gives us as the doctor a way to kind of quantify severity and frequency. I think, advocating for yourself, like if you feel like you're not getting the right answer or the answer that you don't feel like your question was answered, like maybe clarifying your question again.
Hmm.
Um, and then the one thing I will say, though, from a patient perspective, to be aware of is just that unfortunately, doctors do have limited time slots to talk to patients. So, as much as I would love to spend over an hour with each patient talking through all of their concerns, a lot of times you're seeing a doctor who maybe only has a 15-minute slot blocked off to see you.
Yep.
And so being able to kind of clear, in your mind, prioritize what you want to focus on that visit and being open to tabling something for a next visit and scheduling a close follow-up could be really helpful. Um, and then from the provider side, it's the other side of the coin. It's realizing that each patient deserves your full attention. And yes, even though you have 20 other patients that day, setting those expectations of like, let's focus on what is bothering you the most and have them come back to schedule a follow-up. Or you could be seeing a specialist who has a bit more time to focus on your question. It's also, as providers, it's just being humble and recognizing when this is not your area of expertise or you don't know something, and to refer it to an expert or to do your own continuing medical education, I think. And then just validating symptoms. Like, at the end of the day, if the patient is coming to you with a concern, that concern is real, and that we should be advocating for the patient, making sure they feel validated and heard. Um, Unfortunately, as you know, Dr. Hancock, you mentioned this earlier, menopause in particular is so under taught in medical
Mm-hmm.
education. Like, I, in internal medicine residency, received 1 hour of menopause education during my training. So,
Wow.
and that is confirmed based on additional studies. We're looking at like how educated providers are in managing patients going through menopause. And so I think it's important for us as providers to also be eager and willing to learn ourselves with all the new data that's coming out and the interest around menopause hormone therapy, etc. So,
Absolutely. Absolutely. Those are all excellent recommendations. One of the things that I often recommend for my families is to make sure you communicate the reason for your visit. Be as specific as you can so that we can anticipate how much time you will need. I often equate it to going through a drive-through restaurant. If at the drive-through you order a Happy Meal, but then when you go to the window to pay, you say, "Can you also throw in a quarter pounder,
yeah,
supersized meal, an apple pie, and can I get one of those salads and milkshakes?" It's going to, one, back up the entire line behind you. Two, we may not have the capacity to fulfill your order at that time. And so if you communicate that you have a big thing that you're concerned about, there sometimes is space for more complex visits to allow more time. It also helps me as I walk into the door to know what the question is. Often as a pediatrician, and I love my families to pieces, and I have a private practice, so it creates a little bit more space and time for me to spend with my families. It will be at the end of the visit. I'm getting ready to give you your kiss goodnight, and it's, "Oh, wait, doc, did I
yes,
mention that he's also having seizures?" And you're
yes,
just like, "We've been together for 20 minutes. I can't." And then the family's frustrated because they don't want to have to take off work again. And I get it, our
right,
system, that we could spend a whole hour on that.
right,
But
right.
there's a specific allotment of time, especially if it's a physician or a healthcare provider working for an institution, we are allotted only a specific amount of time. And for providers, I would say just make eye contact. We are so wired to our devices now and trying to get our notes done so we don't have to do them when we get home, that we often forget to just make that human connection. Write a couple of notes. I have mastered being able to type well and still make eye contact with my little ones and their families.
That's a
But I think
skill.
that with all of those recommendations, it definitely sets our attendees up for their best success. And obviously, if you've advocated for yourself and you do not feel that you have been heard, it's time to explore another physician option. If you feel that you do not have voice, always bring someone with you who may be able to advocate for you. Bring your sis, your auntie, your mommy, whatever, whoever you need as part of your village in order to provide that support. I see some good questions coming in, so we're going to keep our conversation going so we have enough time to answer these amazing questions. If we experience a provider visit and we feel like we are being dismissed, how do we advocate for ourselves?
Well, I think again, such an excellent question, but I would hope that patients are not feeling dismissed. Unfortunately, this is happening. And so the first thing I'm going to say is that patients just need to advocate for themselves, being very clear. If they feel like they're being dismissed, especially of any menopausal or female symptoms, just
Mhm.
being very using very clear language, like these symptoms are affecting my ability to do X, Y, and Z, asking directly, like, I do not understand this. Can you please explain X, Y, and Z? And I think you should feel very empowered to get a second opinion if you are
Absolutely.
not feeling heard. I, as a doctor, would not be offended if my patient went to get a second opinion. These are patients advocating for themselves. I think at the end of the day, patients just deserve care from a provider who takes them and their symptoms seriously. So if they're not getting it
Absolutely.
from one provider and it's not a good fit, they should feel empowered to seek care elsewhere.
Very good. We're going to pivot a little bit and talk about something that's been in the news very recently, the genetic testing of lipoprotein A. Can you please explain what this is? And sometimes it's referred to as LPA. Can you tell us what this is and how it can benefit our heart health?
Yes, I actually just got mine checked like a couple months ago because of, my family history. But
Mhm.
so lipoprotein A it's a type of cholesterol particle. But it's not routinely checked in your cholesterol panel. So we normally will order a panel where we check your total cholesterol, your triglycerides, your high density lipoprotein, your low density lipoprotein, and it gives us an estimate of like what your cholesterol is and how things are going and gives us a sense of your risk. A lipoprotein A is a newer test that is now being implemented and used more in practice. And the lipoprotein A is a specific type of particle that increases your risk of heart disease and of stroke. And importantly, it's mostly inherited. So it's
Mm,
more of a genetic marker. So it's not really impacted by your exercise or what you're eating the way triglycerides or an LDL would. This is really just this is your LPA and is it high or is it not? I will say what we do know for a fact is that as women age, that number does increase slightly, like during the menopausal transition. That being said, it is a very helpful marker because it helps us as doctors further risk stratify a patient of what their
mm,
risk is of heart disease. And so we're just because your number, like let's say you get it checked, even if it's elevated, that doesn't necessarily mean we're going to treat it immediately and put you immediately on a cholesterol medicine, but it definitely will inform our decision of where we're going to go for your overall heart health, what we're going to do with more personalized prevention plan, whether or not we get a calcium score, et cetera, et cetera. So if you've never had one checked and you have a family history or you have risk factors, I highly recommend getting it done. It's a lab draw. It can just be combined with your cholesterol panel, and it just gives your providers a better sense of what your risk is for heart disease.
that's excellent. I was wondering when we were going to start doing it more standardly. I had mine done a little while ago when I was getting my blood drawn. I actually added the lab myself.
I love, I love it. I will say
Right.
at Hopkins downtown, we have an amazing women's health cardiology clinic here, led by Dr. Erin Mikos, and they really are, encouraging providers to screen patients who have risk factors at least once. So if they haven't had it before, we'll check a lipoprotein A with an apolipoprotein B.
You're about to convince me to make that drive to come get some checkups.
You should come. We also do video visits, so even if you're in Bethesda, and Suburban also has some
Listen,
fantastic cardiologists as well, obviously that we
absolutely.
work with
Yes,
closely. So
absolutely, absolutely. About to make a trek to Moco. I love it. let's
Yeah.
talk about the important, we can't have a conversation around heart health without talking about hypertension or high blood pressure, since we know
hmm
it can affect women, particularly women who are pregnant and in that post-pregnancy period, in perimenopause and in the post-reproductive age. Like hypertension can follow you through your age transitions. Can you explain
Absolutely.
to our audience how one's blood pressure changes as we age, and what are the things that we can do to sort of maintain a healthy blood pressure?
Absolutely. So I will say controlling blood pressure is so important. And, I'm sure everyone on this call knows this, but like heart disease is the leading cause of death in women. 1 in 3 women are going to die from heart disease. And one of the biggest risk factors for heart disease is uncontrolled high blood pressure.
Mm,
And so we also know that high blood pressure is, it's associated with cognitive decline and dementia. So the more we can control the blood pressure, the better. And it's important to be proactive about it. So during pregnancy, you know, if you're having high blood pressure during pregnancy, that can lead to issues not only for the baby, but for the mom. So for the baby, preterm labor, low birth weight, et cetera, et cetera. But then for the mom who's having high blood pressure during pregnancy, it can lead to heart failure, preeclampsia, kidney issues, stroke, et cetera. And really importantly, I think these conditions that you develop during pregnancy also increase our risk of heart disease later in life. So, if
mhm,
you have high blood pressure during pregnancy, if you have a history of preeclampsia, if you have a history of gestational diabetes, a lot of times the PCPs don't ask about our pregnancy complications, but we should because they really impact the risk for developing heart disease in women in the future. But when you go through the perimenopause and menopause transition, so now we're moving to this stage of life, what's happening in the body is as your estrogen declines, that's going to cause these metabolic changes in your body. That increases your insulin resistance. It increases our cholesterol. We gain weight. We're not sleeping well. We're stressed. That all leads to more weight gain, high blood pressure, insulin resistance. And then, as we know, as we age, the arteries themselves become more stiff. And when the
mhm.
arteries are stiff, the heart has to pump harder, and that raises your blood pressure too. So high blood pressure is a multifactorial thing when it comes to women as we age, but there's a lot of different factors that can be contributing here. But as a result, it's so crucial to control our blood pressure for our overall heart health and
Mhm.
preventing issues down the line. And so, right now, if you look at the guidelines, a normal blood pressure, an ideal blood pressure is less than 120 over 80. So the top number less than 120, a bottom number less than 80. But the definition of high blood pressure, if you look at like the HA guidelines, is a top number above 130 and a bottom number above 80. So, like, that is just something to be aware of in terms of what your goal blood pressure should be. And then when it comes to how to prevent, heart disease and blood pressure, um, the American Heart Association actually has a great um, graphic called the Life's Essential Eight. I reference
Mhm.
this all the time. I know you know it well, Dr. Hancock, but it's all very obvious things that really do make a difference. It's eating a healthy diet. It's maintaining your weight, becoming more active and exercising, controlling your cholesterol, not smoking, managing your blood sugar, sleeping well, and then managing your blood pressure. So I think those sound straightforward, but in reality, they're really hard to do. Like I don't know the last time I've had a good night's sleep in a while. So it's just like it's really hard to do, but these are, some easy steps that make a big difference. Like even if you reduce your blood pressure number by 5 points, it reduces your relative risk of heart disease by like 10%. So small changes can make a big difference.
Absolutely. This is all Such amazing information. Thank you so much, Dr. Zhang. We're going to jump into some questions from the audience. The first question, what would you recommend for postmenopausal women who didn't have the benefit of any therapy, information, support, etc.? Sis, you're not by yourself. She is me. Can you piece therapies to address some of the symptoms?
Absolutely. So again, I think it really is it's sad for me that a whole generation of women did not receive hormone therapy related to misinformation from the Women's Health Initiative study and the media hoopla
Hmm.
that came from that, speaking about media and social media and things like that. But that being said, I think one of the things when it comes to postmenopause for women, number one, what we see is a lot of the menopausal symptoms will improve with time. Like even without doing anything, the hot flashes get better, the night sweats get better, your brain fog will improve, eventually your sleep will stabilize. And so a lot of those symptoms will improve and you may not have needed hormone therapy now because symptoms are at a point that you can manage. But the one category of symptoms that just worsen as women age are the genitourinary symptoms,
Hmm.
your vaginal dryness, increased risk of UTIs, pain with intercourse, itchiness and discomfort. Those vaginal symptoms, we call it our genitourinary syndrome of menopause or GSM. Patients should feel comfortable asking and thinking about hormone therapy for that all
Hmm.
the way until they're in their 80s, their 90s. Our urogynecologist at Hopkins is like, take it until you die. Like it's safe, it's
Yep.
local, it's just applied vaginally, and it makes a big difference in symptoms, in reducing your UTI risk. It helps with incontinence. And so I would feel really confident about asking about vaginal estrogen to manage your vaginal symptoms. And then the other therapies, we also have so many non-hormonal treatment options that I'm not even talking about today. But I think it's important to know that we have just a whole toolbox of options to help women, depending on what your symptoms are. But feel confident to ask about the vaginal symptoms and vaginal estrogen. And then if you're really postmenopausal, but still within 10 years of menopause onset and symptoms are significant, you should talk to a provider about considering hormone therapy.
Absolutely. Very good information. Along those lines, someone wants to know, should you stop using HRT once you enter your 60s?
Mm. Great question. So the reason the number 60 is out there is because when you look at the studies, and at Hopkins, we love data. When you look at the studies, what it showed is that in women over the age of 60 or with over 10 years of menopause onset, there was an increased risk of being on hormone therapy, whereas
Mhm.
there was a benefit in patients who were under the age of 60 with being on hormone therapy. So we now no longer use 60 as a clear cutoff, like, oh, you hit your 60th birthday yesterday, I'm pulling the hormones away. We don't do that anymore. Number one, we will taper off. We will taper hormones off, number one. But number two, it really is going to be based on an individualized risk benefit discussion about when patients feel ready to go off hormone therapy. I will say, as they're getting into their 60s, we start seeing the cholesterol rise a little bit
Hmm.
more, the blood pressure goes up a little bit more, and it just changes the balance of benefit and risk for hormone therapy for patients. And so, I do have conversations with women about whether or not they would be open and willing to try a taper and see how they do as they're getting
Hmm.
into their 60s. But 60 is no longer this like, oh, you hit that mark,
Hard
we're
and fast
absolutely
cutoff.
done.
Yeah.
Yes,
Very
we're
good. Well,
definitely
thank
leaning away from that.
thank you, audience member, for that question because that I still remember that 60 cutoff too. So thank you so much for asking that. Another question about HRT. I'm so glad we're having this conversation because clearly there's a lot of information that our audience members want from this discussion. I had a hysterectomy 12 years ago. However, I still have my ovaries. Could I benefit from menopausal hormone therapy? That's question number one. Her second question, which type of labs can a doctor order to determine our menopause stage?
Okay. I love these questions. They're so nuanced and I love it so much. So, the first question is still having your ovaries, no uterus. The ovaries are the important part. You do not go through menopause if you just get your uterus removed because the reason for menopause is you're losing ovarian function and your estrogen is going down. So if you got your uterus out because of a fibroid or whatever reason, but you still have your ovaries in, you're still going to go through natural menopause instead of surgical menopause.
Mhm.
And so if you have your ovaries, that you still have all the protective benefits of having the ovaries in place. You're still producing estrogen, it's still protecting your bones, it's still protecting your heart, etc. That being said, if you are having significant symptoms of menopause that are really impacting your quality of life, then I do think, and you don't have any reasons to not being on hormone therapy, then I think patients could benefit from hormone therapy based to just to help with symptom relief. The second
Mhm.
question, in terms of what are the labs, in this specific case where a patient does not have menstrual cycles because they had their uterus removed, that's where the labs can be really helpful because it'll tell us exactly. We can't base it just off your menstrual cycle. I can't say it's been 12 months since your last menstrual cycle because you just don't have them anymore. So we'll check hormone levels for sure. We usually check an estrogen level, an estradiol, and we check what's called an FSH, a follicular stimulating hormone level. Those are the two primary ones. I usually also add on progesterone, etc. The one thing I would caution people to ask about getting blood work done for hormone labs is if you are in the menopause transition, your hormones are not a nice, calm curve. They are a roller coaster of hormones. And
Yeah.
so if I, as your provider, check your labs this this Thursday, tomorrow, and I check them 2 weeks later, they're going to be all over the place. And so we have very specific reasons why we check hormone labs, but I would not necessarily use just blood work to identify what stage of menopause you're in. But it can help in patients who are not bleeding or not responding to therapy. Like there are some indications for it.
Very good. This circles back to something you mentioned earlier when we were talking about lipoprotein A. Someone asked, is a cardiac calcium score important?
Ah, so a cardiac calcium score, what is that? So um, it is a heart CT. No contrast. It's a picture of your heart, and it's specifically looking at the heart arteries, our coronary arteries, and it's measuring if there's any calcium buildup in those heart arteries. And the radiologists, based on how much calcium there is, they give us a score of how much buildup of calcium because basically they are equating calcium buildup to plaque buildup.
Mhm.
And so if you see calcium in your arteries, then like the likelihood is very high that that's plaque in your arteries, which is heart disease. So we have a cardiac calcium score or a coronary artery calcium score can be very helpful in patients who have a higher risk score, and we're trying to determine whether or not putting a patient on a cholesterol medication is going to be really helpful and beneficial for them. If their score is really low, their risk is really low, they don't have a strong family history, their cholesterol looks fine, they don't have risk factors, a cardiac calcium score may not give us too much information, but patients who are either really high risk or in that intermediate risk where we're not sure, getting a calcium score can really make a difference.
Absolutely. It also gives, for those of us who have strong family histories, it gives at least a little bit of peace when your score is low.
Yes.
I
The
can
goal is
speak to
zero. That's
the
what we
goal
want, a
is
score
zero.
of
I'm like,
zero.
if I hear zero, I can release the breath that I'm holding. We will
Yes.
end our question session with this last last question because I think it provides a good summary and makes sure that everyone leaves our conversation with good clarity as it relates to hormone replacement therapy. Someone wants clarity on if estrogen therapy increases heart disease risk and what to make of the most recent guidelines.
Yes. So I appreciate that question to kind of summarize today's discussion because, again, you'll see social media, you're going to hear estrogen is protective of the heart. Everyone should take it. And then you're going to hear estrogen causes heart disease. No one should take it. And I think the key takeaway from today's conversation is that estrogen should be individualized to each patient. That being said, what we know right now, based on the data, is that in younger patients who do not have known heart disease, estrogen is protective of the heart and prevents heart disease in the future. In patients with known heart disease or diseased vessels or who are older, and by that I mean over the age of 60, after 10 years of menopause onset, there is a higher risk of heart disease. And so we're a bit more hesitant to give estrogen in that patient population.
Excellent. That was a very clear and concise way to break it down. Thank you so much. Well, everyone, that is all the time that we have here for today, unless there's a last minute question you want to slide in. We have maybe a minute or two for rapid fire round. If not, I'm going to keep my eye on the chat. If I see a question sneak in, I will make sure that we pull it back in. But I just want to make sure that Dr. Zhang and I, we want to thank you so much for joining us today. Before we close, I wanted to remind everyone to please complete the evaluation as the link will appear at the end of our webinar. So don't hop off yet. Make sure that your voice is heard by providing feedback in that evaluation. Dr. Zhang, thank you so much for who you are, the work that you do, the conversations that you are creating in our up and coming physicians, our current physicians practicing, and in giving space for the community to truly understand women's health and specifically how we navigate through these various phases of life, particularly menopause. I have learned so much today and have some notes, and I probably will be sending you some follow-up questions myself. Thank you for your
Absolutely.
time and your expertise. You you've knocked this conversation out of the park. I hope that everyone's questions have been answered and that you feel empowered to advocate for your health and the health of every girl and woman in your life. Please visit goredforwomen.org for trusted resources and information for women at any stage of life. We must take care of our hearts and our health, and that starts with learning more about what to look for, what to ask about, and how to advocate for yourself and your loved ones. I thank you all for joining today's session. Happy Heart Month. Make sure you keep rocking your red between now all the way through the 28th of February. We want to remind you that this is a recorded session. So as soon as the link is available, sharing is caring. There are a lot of women who are going through perimenopause and menopause without this valuable information. Dr. Zhang is doing a phenomenal job of training us all to have this conversation with our providers. But it's important for us to share this information with our loved ones. Okay. Please make sure you share it, keep the message going, keep the conversation at the forefront of our lives, especially when it comes to women's heart health, because it is our number one killer. I want to make sure I thank the American Heart Association for allowing me the opportunity to participate as the moderator, to Suburban, to Johns Hopkins, the entire team, everyone behind the scenes that's making sure that this is running smoothly. Thank you so much to everyone. Have a blessed rest of your month and year, and make sure you're maintaining a healthy lifestyle, including getting good sleep and maintaining those stress levels. All right. Take care, everyone. It's been a fantastic hour.